Hello, I'm Dr. Carolyn Ross, and I'd like to tell you a little bit about myself. I graduated from University of Michigan Medical School, and then after that I did a internship and residency at Loma Linda University in preventive medicine. My goal in doing that was really to help me understand how to help people change their behaviors, because early on I saw that most of the diseases that we see in medicine have to do with people's lifestyles, whether they smoke or what they eat and whether they exercise. So preventive medicine really helped me to hone my skills in that area. But after I had been in practice for some time, I realized that I didn't learn everything I needed to know in medical school or even in my residency. So I started looking for other things to bring into my practice to help my patients, and that led me to doing a 2-year fellowship with Dr. Andrew Weil's program in integrative medicine at the University of Arizona in Tucson. And that really turned me into the integrative physician that I am today. Early in my career, I really focused on primary care and even opened 3 women's centers in San Diego that provided office gynecology and primary care for women. However, when I was at the University of Arizona doing my integrative medicine fellowship, my middle son, Noah, died as a result of his mental illness. This then changed my direction in medicine, and I decided to focus my attention on treating mental health issues. And from there, I went on to become the head of the eating disorder program at Sierra Tucson in Tucson, Arizona, where I treated depression, anxiety, of course eating disorders, and also addictions. And I developed an integrative medicine approach, the first one in the country for treating those diseases. Since leaving Sierra Tucson, I started doing consulting with treatment centers all over the country. And basically what I did is to help them develop an integrative approach to eating disorders and addictions, and to build their eating disorder programs in that way. I was able to speak all over the country and also internationally. Most recently, what I've been doing besides continuing the consulting is to focus on building a practice here in Denver, Colorado. Not just in the local area where I do integrative medicine for eating disorders such as anorexia, bulimia, binge eating disorder. I also have an obesity management program, and I treat addictions, including being a Suboxone providing physician for opiate addiction. But I also do work internationally still, both in my speaking and also working individually with clients via Skype or phone. You may be wondering what's different about me. After all, I am a medical doctor who went to medical school, but my approach is completely different. I really do treat the whole person. We say body, mind, and spirit, but just as an example, I work with people on food sensitivities, and I also help them with trauma issues, help them develop different ways of coping with their issues besides using food or substances. So it's really a whole person approach, and I hope this has given you a little bit more information so you can feel more comfortable contacting me. I would love to work with you.